You're sitting on the couch, scrolling through your phone, when suddenly, your eyelid starts jumping. Not blinking, twitching, like someone's tugging it with an invisible string. You try to ignore it, but now your calf muscle joins in. A tiny flutter under your skin, then your thumb. Now you're wondering, is this just stress, too much coffee, or is my body trying to tell me something serious? Here's what's terrifying. Muscle twitching can be completely harmless, or it can be the first whisper of a devastating neurological disease. The difference isn't always obvious. So how do you know when that annoying twitch is just your body being weird, and when it's time to see a doctor immediately? Let's start with the shocking truth about how common this really is. According to research published in the journal Neurology, more than 70% of healthy people experience benign muscle twitches at some point in their lives. That's right, 7 out of 10 people. These spontaneous muscle contractions, medically called fasciculations, are visible fine contractions of muscle fibers that occur without your control. They can happen anywhere in your body, your eyelids, legs, arms, even your tongue. But here's where it gets interesting. While most fasciculations are completely harmless, there are specific warning signs that separate benign twitching from something that demands urgent medical attention. The key is knowing what to look for. Number 5. The stress and anxiety connection. First, let's talk about one of the most common triggers: anxiety and stress. When you're anxious, your nervous system releases neurotransmitters, chemical messengers that tell your muscles to move. But here's the problem. During anxiety, these neurotransmitters can be released even when there's no actual reason for your muscles to contract. It's like your body's communication system is sending false alarms. A study examining the relationship between benign fasciculation syndrome and health anxiety found that anxiety symptoms may actually play a causal role in the development of benign fasciculations. The mechanism works through your body's fight-or-flight response. When stress hits, your body releases adrenaline and cortisol. These stress hormones prime your muscles for action, but this heightened state of readiness can cause muscles to become tense and eventually twitch as a side effect of constant nervous system stimulation. Even more fascinating, anxiety doesn't just create twitches, it amplifies how you perceive them. When you're in a heightened state of anxiety, your threat response system becomes hyper-aware of bodily sensations. A minor twitch that might normally go completely unnoticed suddenly becomes a source of intense focus and worry. This creates a vicious cycle. The twitching causes anxiety, which causes more twitching. Number 4. The caffeine factor. Here's something that might make you rethink your third cup of coffee. Research published in PMC demonstrates that caffeine directly affects muscle contraction by increasing calcium release from the sarcoplasmic reticulum, essentially the storage site for calcium in your muscle cells. When caffeine enters your system, it causes calcium to flood into muscle fibers, making them more excitable and prone to involuntary contractions. A study on caffeine-induced effects on skeletal muscle found that caffeine at doses commonly consumed, we're talking about the equivalent of 2-3 cups of coffee, significantly altered muscle contraction time and increased muscle fiber activity. The researchers noted that caffeine doesn't just affect your central nervous system, it has a direct peripheral effect on the muscle itself. But here's the catch. If you're a regular caffeine consumer and you suddenly stop, you can experience rebound muscle twitching. The same medical research indicates that when your body becomes accustomed to a certain level of caffeine, abruptly stopping can trigger withdrawal symptoms, including muscle spasms and fasciculations. Number 3. The magnesium mystery. Now let's talk about something hiding in your body that could be causing those twitches: magnesium deficiency. A systematic review published in PMC on movement disorders associated with low magnesium found something striking. In patients with critically low magnesium levels, below 1.3 milligrams per deciliter, 15% experienced twitching of extremities as a primary symptom. Here's why this matters. Magnesium plays a crucial role in nerve and muscle function. Scientists believe these twitches are caused by calcium entering nerve cells. When magnesium levels are adequate, magnesium competes with calcium for binding spots on muscle proteins. But when magnesium is deficient, calcium floods in unopposed, overstimulating the muscles and nerves, causing them to twitch and spasm. According to research, magnesium deficiency can occur from multiple causes. Certain medications like diuretics and proton pump inhibitors, chronic diarrhea, alcohol abuse, and even excessive exercise that depletes your electrolytes. Between 2.5% and 15% of Americans experience magnesium deficiency, and that percentage is far higher for people with diabetes, celiac disease, or those who consume alcohol regularly. Number 2. Benign fasciculation syndrome versus something serious. Here's where we need to get very specific about the difference between harmless twitching and something that requires immediate medical attention. Benign fasciculation syndrome, or BFS, is persistent muscle twitching with no underlying neurological disease. According to Cleveland Clinic research, the fasciculations in BFS usually occur at a single site in a single muscle at a time. The twitches are most noticeable when your body is at rest and typically stop when you start using that muscle. But then, there's the condition that terrifies everyone who Googles their symptoms: amyotrophic lateral sclerosis, or ALS, Lou Gehrig's disease. Research from the ALS Association reveals critical differences. In ALS, fasciculations are more likely to occur in multiple muscles simultaneously, not just one isolated spot. More importantly, ALS fasciculations come with other symptoms that BFS does not: progressive muscle weakness, muscle atrophy, visible shrinking of muscles, difficulty with breathing, speaking, or swallowing, and loss of reflexes. A comparative study published in ALS United Greater Chicago Research found that ALS patients exhibited a higher proportion of high-grade fasciculations, 41.5%, compared to non-ALS patients at only 11.9%. Furthermore, the frequency of fasciculations in ALS patients can be up to 10 times greater in strong muscles and 40 times greater in weak muscles compared to those with benign fasciculation syndrome. Here's the critical distinction from the National Institute of Neurological Disorders. Muscle twitching alone is rarely indicative of ALS unless accompanied by other symptoms such as muscle weakness or atrophy. If you're experiencing only twitching with no other symptoms, the odds are overwhelmingly in your favor that it's benign. Number 1. When you absolutely must see a doctor. This is the most important part of this entire video. There are specific red flags that mean you should stop watching YouTube and schedule an appointment with a neurologist immediately. According to medical research published by the Muscular Dystrophy Association, you need urgent evaluation if you experience any of the following alongside your muscle twitching. Progressive muscle weakness, especially if it's asymmetrical or affects one side of your body more than the other. If you're dropping things, having trouble gripping objects, or noticing that tasks requiring fine motor control like buttoning clothes or writing are becoming difficult, this is a warning sign. Muscle atrophy, or visible shrinking of muscles. If you notice that one of your arms or legs is becoming noticeably thinner than the other, this requires immediate medical evaluation. Changes in speech or swallowing. If you're developing a hoarse voice, slurred speech, or having difficulty chewing or swallowing food, this could indicate bulbar onset motor neuron involvement. Breathing difficulties. Any unexplained shortness of breath or feeling like you can't get a full breath should be evaluated urgently. Twitching that persists in the same location for more than several weeks without improvement, especially if it's accompanied by muscle stiffness or cramping that doesn't respond to stretching or rest. The diagnostic process, according to research from Massachusetts General Hospital, involves comprehensive neurological exams, electromyography to measure electrical activity in muscles, nerve conduction studies, and blood tests to rule out metabolic disorders, thyroid dysfunction, or electrolyte imbalances. But here's what you also need to know. An Australian prospective study of 20 physicians who experienced fasciculations found that 14 of them were extremely concerned about having ALS. After thorough evaluation with electrophysiological studies, none of them had ALS. The fasciculations were benign, primarily affecting the lower limbs, and showed no signs of denervation or neurogenic changes. The median time between initial symptoms and a definitive ALS diagnosis is typically 10 to 16 months because doctors need to observe whether symptoms progress or remain stable. Benign fasciculation syndrome is diagnosed only after ruling out all other possible causes. So what's the bottom line? If your muscle twitches are isolated, come and go, worsen with stress or caffeine, and you have no other symptoms, no weakness, no atrophy, no difficulty with basic functions, the likelihood is that you're experiencing benign fasciculations triggered by lifestyle factors. The most effective approach is to manage the triggers, reduce caffeine intake, ensure adequate sleep, manage stress through relaxation techniques, stay properly hydrated, and consider whether you might need magnesium supplementation, though you should always consult with your doctor before starting any supplements. But if you notice progressive weakness, visible muscle wasting, persistent twitching in the same location for weeks, or any difficulty with breathing, speaking, or swallowing, don't wait. See a neurologist. Early evaluation matters, not because muscle twitching alone indicates something serious, but because if there is an underlying condition, early intervention can make a significant difference in outcomes. Remember, your body talks to you through symptoms. Most of the time, muscle twitching is just your body being stressed, tired, or overcaffeinated. But occasionally, it's trying to tell you something important. Learn the difference, pay attention to the warning signs, and when in doubt, get it checked out. If you found this information helpful, please share it with someone who needs to hear it. Give this video a like and subscribe to the Pain Story channel for more evidence-based health content that helps you understand what your body is telling you. Your health matters, and knowledge is the first step toward taking control of it.